This video introduces the development of a healthcare quality improvement project charter for nurses. Viewers will review the definition of a project and creating a quality improvement project problem statement. Hi Andrew, I need to ask you for some help.
Hi Juanita. What can I do for you?
I know you recently completed your quality improvement training for our FQHC. I have been evaluating our performance data, and we have a problem with some of our results. Our pre- and postnatal care metrics for our Hispanic women clients is not meeting expectations or national benchmarks. Our performance measures are behind many of the other rural FQHCs in the state. Our clients do not come in for prenatal care until well into their pregnancy, and then are diagnosed with gestational diabetes. There are a lot of large babies being delivered, some with complications. We also are not meeting benchmarks of postpartum follow-up for baby and woman checks within a week after delivery. I need you to review our data and run a project to improve the care for these women and their newborns.
Okay Juanita. I can start that project. I will first want to develop a quality improvement project charter. As our clinic director, will you be the project sponsor?
I will be a project sponsor, but I need Dr. Gomez as the medical director to be the co-sponsor. We will set up a regular reporting method where the three of us can get together. Could you start evaluating the literature and clinical best practices, so we know exactly what is the problem and what this project will do to improve our pre- and postnatal care for Hispanic women who come to our clinic?
Yes, I will begin working on this later this afternoon after I finish up one other activity. Give me the rest of the week to work on the development of the project problem statement and description. I will set up an appointment with Sally, your admin assistant, to meet with you and Dr. Gomez early next week.
Thanks, Andrew. As the project leader, your nursing clinical experience in population health and now quality improvement will be a big help.
Before I dive into creating the problem, I am going to review what exactly is a project, so I start the charter correctly. A project has 3 definable characteristics. 1. The quality improvement project is chartered to address a quality gap or problem. The project needs to have a clear goal to address a process or system problem. 2. Projects are temporary. The project has a defined beginning and end date. And 3. Projects use organizational resources. The resources most frequently allocated to a project are people's time to develop and implement the project. Dr. Gomez as the medical director, and Juanita as the clinic director will be the project sponsors. They will provide guidance to me on meeting expected benchmarks and standards of care for our clients. Juanita will help make sure I have a budget to pay for some of our clinic staff to become part of the project team and reorganize job responsibilities so that client care is still being performed in the clinic. The Quality Improvement Project Charter is our guiding document that outlines exactly what we will do, how we will do it, what will be the outcomes, and how to know if we are achieving the outcomes we want. In our Quality Improvement Project Charter, there will be project goals and the expected outcomes and benefits of those goals. How will the outcomes, processes, and balancing components be evaluated and measured? Who is on the project team and the stakeholders that will be involved in this quality improvement project? How will the project team communicate and work together to avoid conflict, activities, and change ideas to achieve the outcomes and benefits of the project? And assumptions, constraints, and risks to the project. Well, I have been searching the literature for current evidence-based practice, the American College of Obstetricians and Gynecologists Standards of Care, and the National Committee for Quality Assurance Performance Improvement Measures. There are 2 issues to address with this project. 1. 45% of our pregnant Hispanic women clients are not coming to the clinic for prenatal care until they are in their 6th month of pregnancy or later. 2. 65% of our Hispanic women who have given birth are not being seen in the clinic within 3 weeks after delivery. While the national measures allow for 4 weeks to be seen, many of our Hispanic women clients have type 2 diabetes, are pre-diabetic, or were diagnosed with gestational diabetes and require earlier follow-up with their newborns. Activities I will recommend are that the clinic implement the Familias Sanas program and provide additional education for the community health workers to identify women who are in their first trimester of pregnancy and have recently given birth so they can be evaluated sooner. We also will have a dedicated team of a certified nurse midwife and 2 nurses to follow these clients through their pregnancy and postpartum period. The nurses will need additional training on the Baby Talk program on a healthy pregnancy and lactation so they can better assist those mothers who wish to breastfeed. The literature review demonstrates that many Hispanic women do not have a trust relationship with health providers. This could be due to immigration status, lack of health insurance, poor cultural competency by health providers, or providers' inherent bias leading to poor healthcare delivery. The project will introduce steps to build trust relationships and improved monitoring of women. I will call to make arrangements to present the Quality Improvement Project to Juanita and Dr. Gomez to get their feedback and sign off on the problem and project description at our meeting next week. Then I can move on to the next part of the charter.
This concludes part 1 of the Project Management for Nurses series on quality improvement projects. The project charter and the project problem statement were covered in this video. Part 2 will examine how to determine the quality improvement project expected outcomes and benefits, and develop the aim statement.